So the question is, are probiotics useful in the treatment of depression? So this topic relates to a word that's called psychobiotics, which has been coined particularly for that reason, that microbes can affect psychological processes. Like in many areas of microbiome science, if you just look at the animal studies, the answer is yes. So you can manipulate the gut microbiota and the molecules that they produce, and you can have a pretty profound effect in animals, which is called emotional behavior or depression-like behavior. Obviously, they can't say if they are depressed or not. So it gets a lot more difficult if you want to translate these findings obtained in animal models of emotion-like behavior to complex human conditions such as depression or anxiety or attention deficit disorder. And the quality of the studies is much, much weaker. There's several studies that show some effects of a probiotic treatment condition on improved mood. Some of them are done in healthy people without clinical depression, just having a low-grade depressive mood, but not really having a clinical diagnosis. Make a long story short, in my opinion, there's currently no evidence that treatment with probiotics by itself has a significant antidepressant effect that it would justify to put somebody who suffers from depression and on a probiotic treatment. If that individual is on antidepressive therapy, be it cognitive behavioral therapy or medication therapy, the addition of a probiotic is certainly not going to hurt. If that person feels better taking the probiotic, I would encourage him or her to continue taking that. But I would say the last word on psychobiotics is not out. Animal data strongly suggestive. Human data still lacking in consistency. And one thing that may happen in the future, people are talking about engineering microbes, for example, to produce antidepressive substances or anxiolytic substances, such as the neurotransmitter GABA, which the brain also produces to decrease anxiety. This is something that companies are working on, but it's not something that we'll see anytime soon in terms of a therapy, a novel, effective therapy for depression.